When women first start breastfeeding, sometimes the nipples can be very painful. And this is extremely common, and it can happen with every pregnancy, not just the first one. One of the most common reasons that you develop nipple pain while breastfeeding is some problem with the baby's latch that is causing the nipple to have too much suction. So it's important when you're breastfeeding to make sure that the entire nipple is in the baby's mouth and not just the tip of the nipple. When a baby is very small, sometimes their mouth is also small and it's difficult for them to get the entire nipple. If you have a larger nipple and you're finding that the baby is only getting the tip of your nipple, that can lead to cracking, redness, and severe pain in the nipple, as well as bleeding. That can in turn lead to an infection, and we become concerned about that. If you're finding that the baby is not able to have a full latch with the entire nipple in the baby's mouth, we would recommend talking to a lactation specialist or your OBGYN about additional prompts that you can use for that baby. One of the more common ways that we help women who have a broad nipple is to use a nipple shield. And that's a little plastic device that helps the baby apply more even suction to the nipple. You don't necessarily have to use that the entire time you're breastfeeding, but it helps the nipple develop and the baby's mouth develop to where that latch is better. Another reason you can develop nipple pain while you're breastfeeding, even if the latch is appropriate, is just from that initial period of a lot of breastfeeding. Babies feed every 1 to 2 hours sometimes when they're newborns, and that's a lot of constant stimulation of a nipple that has never been exposed to that pressure before. Something that we recommend is every time you breastfeed, expressing a little bit of milk or colostrum after the baby is done and letting it air dry on the nipple to act as a moisture barrier. You can also use things like lanolin cream, which can be applied to the nipple area. I don't recommend applying that directly to the end of the nipple where the baby would latch, because occasionally the baby doesn't like the taste or the texture of that cream, which is why sometimes your own breast milk is better. But you can definitely apply it to the base of the nipple, and that can help with pain and symptoms there.